So I wanted to talk about a recent experience I had. I decided to go ahead and get the Quest AD Detect p-tau 217 test. Quest has a new Alzheimer's disease screening test called AD Detect. There are 4 tests involved in that, which include the phosphorylated tau 217, the phosphorylated tau 181, the beta amyloid 42-40 ratio, and the apolipoprotein E, which is the genetic test to see your predisposition or your risk factors. I've never really been a big fan of spending $1,000 to get the ApoE test because it's not actionable in a way. It just tells you your risk. But the new p-tau 217 actually can predict the presence of Alzheimer's disease up to 20 years before symptoms start to show themselves. So I thought, if there's anything you're going to do that might give you impetus to make some changes, it would be the p-tau 217. So I went to Quest, had to get my primary care provider to order the test, Snarky NP, and the test came back. Now, ideally, you want the test below 0.15. Unfortunately, mine came back 0.07. If it's up to 0.2, it would be considered moderate. Above 0.2, and you're at risk. So once you get the test, what would you do? Now, if you had a high test, there are several things you can do. One, you need to get your ideal body weight. You need to get your weight to ideal because excess body fat is inflammatory, and particularly on the brain. The second is increase your exercise, particularly strength training. I think increasing your muscle mass is probably a very effective way to reduce your risk of Alzheimer's. So get rid of all the junk food, all the snack foods, read up in inflammatory foods. I personally think the Mediterranean or the MIND diet are effective, but if you're into carnivore, get in a healthy carnivore. A Big Mac and an order of fries and a shake at McDonald's is not a healthy diet, regardless of which camp you're in. So if you want to be carnivore, eat healthy proteins, healthy greens, do protein shakes and things like that. But stay away from the junk foods either way. But get to that ideal body weight, increase your exercise. Now, what supplements have been shown to help with preventing or maybe treating early Alzheimer's disease? The big thing lately is creatine. And the 5 grams per day you use for building muscle is not enough. It looks like you have to take 20 grams a day to improve cognitive function. Now, some people say take a loading dose of 20 grams a day for the first week, then you can cut back. And I read about people with things like long COVID or brain fog showing some significant improvements with the creatine. I think that astaxanthin, which is the chemical that gives color to salmon, has shown some benefits in neurocognition. I think coenzyme Q10 can improve mitochondrial health, so that's something that I would suggest. A lot of vitamin D and multivitamin are showing some promise, although I'm concerned that the studies are being done by the people that sell multivitamins, particularly the Centrum Silver study looked that people taking a multivitamin did better, but I'm always skeptical when the company selling the drug did the study. But probably you should take a multivitamin and a vitamin D supplement. What medications can you get off-label that might help with your preventing you from progressing on to Alzheimer's disease? Number 1 would be sildenafil or Viagra. It's been shown that people take it have a significantly reduced risk of getting Alzheimer's. The drugs that I'm a big fan of are GLP-2s, and there's some evidence that rapamycin has some inflammatory effects on the brain. Of course, getting your blood pressure to 120/70, getting your LDL cholesterol to around 50. However you do that, I'm a big statin fan, but if you don't want to take statins, do whatever it takes to get your LDL cholesterol below 50. And then the last and not least, and I've already forgotten what it is, I may have to look at my notes here. Medications. Oh, the GLP-1s. I don't take GLP-1s. As yet, because they're not budget friendly yet, even though there is some evidence they may help. The problem is the studies are showed in very overweight people or diabetics with a lot of body fat. GLP-1s are showing big anti-inflammatory effects. But what does it do to someone who is normal weight, who's exercising? I'm not sure I'm convinced the data yet. Enough to spend that kind of money. You can get an SGLT2 inhibitor for $50 a month. You can get sildenafil for $10 a month. The creatine is pretty cheap, Look for the better brands. The Influenza Q10 is cheap. So being this budget longevity, those are all things you can do if your test comes. But I think it's worth the $300 to pay out of pocket to get the p-tau 217 test at Quest. Only Quest has this right now. So Quest Labs p-tau 217 to get your idea about what your risk or degree of Alzheimer's is right now. It's not a genetic test. This is actually measuring tau proteins circulating that tell you have tau proteins in your brain. So get the test and then make your changes in your lifestyle and medications and vitamin stack, whatever, to get that number. And I would suggest maybe repeating in 6 months. If mine had been elevated, I'd probably repeat it in 3 months after making some changes. Thanks for watching. Welcome back to Budget Longevity, and we'll see you on the flip side.